My name is Bob Weaver. I'm 63 years old, and I'm an insurance broker. Yes, I was treated for the CyberKnife in 2007. Went in for my usual physical, normal physical. So we need to send you in and have a biopsy of the tissue because you have a 7 PSA reading. And I said, okay, fine. Before we break out the cutlery, we'd like to have you talk to Dr. Fuller.
I'm a board-certified radiation oncologist. I received my training completed in 1988. San Diego was the first job I took, and it's stuck, and 24 years later I'm still here. At the 30,000-foot view, the first thing we're trying to figure out is it localized or is it extensive? And again, in the PSA era, probably about 95% of the prostate cancer patients these days are localized. So we design a very conformal CyberKnife treatment plan that hits the prostate itself, and it especially hits the areas of the prostate that we suspect are harboring cancer cells. And then we create these really razor-sharp margins outside the prostate. So in a way, it's almost prostatectomy by computer.
The treatment was, basically lying there while the machine did its thing, and looking at the ceiling and wondering when it was going to be over, and that was about the extent of the treatment.
So the CyberKnife is a sophisticated image-guided device. It's a robotic arm, and it's coupled with X-ray imagers that continuously track the target. So it's almost like a form of artificial intelligence is what it really is. It has the X-ray imagers that act like eyes, and then it has the computer that reconstructs the location, and then it has this robotic arm with a linear accelerator that fires beams, and these things all interact autonomously. So it'll detect, analyze, correct aiming position, fire, detect, analyze, correct aiming position, fire. It'll keep doing that from start to finish. So what that'll do is it'll keep the accuracy sub-millimeter from start to finish, or end to end, and no other device that we have currently does that. Our goal is to cure 100% of the cases 100% of the time, and actually if we get things at a localized stage, we're not that far away from that. The real challenge with cancer is getting them in there early. PSA actually, for all the controversies in our news media, is a wonderful screening tool. So it has caused the identification of prostate cancers at a much earlier stage than we used to treat them, and hopefully I don't look like it, but I'm old enough to have trained before PSA. Our prostate cancers were a lot more advanced in that area. One thing I think where the CyberKnife in particular holds up really well is cost. It actually undercuts probably the other most common external beam radiation methods on a cost basis. And on a convenience basis, it allows us to deliver a course of treatment in a week, whereas traditional radiation therapy takes 2 months.
For me, the situation is I have no side effects. I mean, it was painless. All symptoms went away, and if you told me that you didn't do anything, I would believe you. I mean, it was like nothing happened. I'm really happy with the way it turned out.
Our sexual outcomes in our guys have been very good. I think quite competitive with everything else out there. And in particular, they break down according to age. So far, our preservation rate in men under 60 is close to 100%. I'm reluctant to say 100 because nothing in life is 100, but this is pretty close. Over 70, it drops to about 2/3. So we've seen a pretty powerful age relationship. Young men, it's worked great. And over 2/3 of men over 70 is still, I think, is competitive with certainly nerve-sparing prostatectomy or other approaches.
I came away with no change, and so I'm really happy about all of that. I'm just feeling I was blessed that I had a urologist that before he broke out the knives, he sent me to have a chat. So thankfully that happened, and I just hope that a lot of other people get that opportunity too.